Okay, go ahead and read the stem, please.
6-year-old 25 kg boy underwent tonsillectomy few days back. On his post-operative day 6, there is severe bleeding and he became hypotensive and tachycardic.
So tell me about the management of this patient.
Yes, sir. So I will manage this patient through the critical ill care of critical surgical patient protocol with ABCD approach. I'll manage the airway airway first by encouraging the patient to sit up and spit out the blood, and we'll do a suctioning of the any pooled up blood or secretion with a Yanko suction. And meanwhile, I'll calm down the patient and the relative and maintain a calm environment around the patient. And also I'll insert two large white bore cannulas to and take out blood for full blood count, coagulation profile, group and save, and routine blood investigation. And we'll start IV fluids, 15 normal saline at 15 to 20 minutes IV bolus, and will request for urgent cross match if he is actively bleeding and is in shock. Otherwise, I'll call for help. I'll inform my surgeon and the anesthetist. I'll keep the patient nil by mouth by. I'll also give the patient IV tranexamic acid, 15 milligram per kg to stop the bleeding. And if there is active bleeding, I'll apply or topical adrenaline soaked balls, and will keep the tail of the adrenaline balls outside of the mouth, and will check if the airway is patent, whether the patient does not, if patient requires any invasive method of breathing or not. And I'll give the fluids using the holiday cigar formula. In this patient, I'll give the bolus fluid. I will give according to the 20 ml per kg per body weight. And for the maintenance fluid, I'll give for the first 10 kg 100 ml per kg day. Then for the next 10 kg 20 ml per 50 ml per kg per day. And then for the weight after 20 kg, I'll give 20 ml per kg per day for this patient.
Very, very good. Just mention about the eye specs that I'll go for the eye specs around the back of the patient neck, correct?
Yes, I expect so.
Okay, yes, very good. Now, let's go for the next one. Tell me, patient has a HB of 7.8. So, what will you consider?
Apart from IV fluid resuscitation, I will consider for blood transfusion in this patient.
If the patient parents had Jehovah Witness, does this change the situation?
I'll first try to counsel the patient's parents regarding the need and the emergency condition. But if still they refuse, I'll involve my consultant to use the law for the best, for the in the best interest of the child.
So, for the best interest of the patient, we have to transfuse the blood, but for that, we have to take a
Yes.
signature from two consultant on consent form 4. Remember, okay? Now, what
Yes.
if bleeding did not stop despite the above measure?
Then I'll inform the OT staff and the anesthetist, and will arrange the OT. Will take up the patient for under GA, and after using the WHO surgical checklist, I'll either ligate the bleeding points will cauterized, and in rare cases I'll consider for embolization of the bleeding artery also.
Okay. Rarely the embolization of which artery?
External carotid artery.
Okay, which is the branch of?
So common carotid artery.
Now, you mentioned about this external carotid artery. So, if you stop this artery, it will further stop bleeding where? In which artery? The sphenopalatine artery, okay?
Sphenopalatine artery
Yes.
or the maxillary arteries.
Okay, very good. What type of diathermy you will use?
I'll use for diathermy, bipolar diathermy,
Why?
because of the short burst and to prevent any tissue losses in the nearby region.
Which is which structures? The nearby structure?
The nearby structures are the
Common carotid artery and the
Uh,
carotid nerve, remember,
it
okay?
is better.
Yeah. What to do before
Yes.
extubating the
For,
patient?
I'll suction the patient because there can be clotted and swallowed blood and will consider to put a nasogastric tube.
How to confirm that you are operating the correct patient?
I'll use a WHO surgical safety checklist before
Very good.
inducing the patient.
Very good. Very good. Excellent. Okay.